Hi, today I am bringing a new topic and I'll be talking on hearing loss. So hearing loss is such a very common problem, especially in the old age. Anyone above 65 years of age are very much liable to be having some form of hearing loss, some degree of hearing loss. So in the general population, about 50% and more, that means more than half of the population beyond 65 years of age are suffering from hearing loss. Okay. Now, first of all, let us try to know what are the types of hearing loss. Hearing loss can be, at different levels, different parts of the ear. The ear as such has got three parts. One is the external ear, another one is the middle ear, then the inner ear. The sound that comes from outside has to go through the external ear and the middle ear so that it can be transferred to the inner ear, which is where the nerves are. So if there is any defect in the first two, that is the external and the middle part of the ear, then we have a conductive hearing loss. That means the hearing loss is because of some problem in the conduction of sound to the nerve part of our ear or hearing. So if there is any problem in the inner ear, that is in the nerve part, then we have sensory neural hearing loss, that is nerve defect of hearing loss. Then if there is a mixture of these two, then we call it as mixed hearing loss. That means problem in the outside and the middle ear, some problems, then also in the nerve part, then we call it as a mixed type of hearing loss. This can be detected by audiometry, which I will come later on. Okay, now how do we hear? First, the sound comes from outside in the air by vibration of the ear particles, and it goes inside the external canal, external ear, and strikes the eardrum. And once it strikes the eardrum, this sound energy is now converted into mechanical energy. And now this mechanical energy of movement of the tympanic membrane is transferred. The eardrum is transferred to three more small ossicles or bones, small bones, minute bones inside the middle ear. Okay, these small bones, when they vibrate, when they move, they also stimulate the inner ear by movement of some fluids inside the inner ear. That is, we call it as cochlea. From there, it is the sound energy has now converted into the mechanical energy in the middle ear. Then in the inner ear, it is converted into electrical energy. And these electrical impulses are carried through the nerves to the brain, and where we perceive our sound. We perceive the sound that we hear. That means our ear is just a microphone, just the receiver of the sound and the transmission of the sound. From there, what we hear is in our inner ear by the brain. Right? Now let us come to the symptoms. How persons have symptoms of hearing loss. First of all, there is some difficulty in understanding speech, especially say while the person is inside a crowd or in a noisy surrounding. Next is trouble in understanding of speech, especially the consonant part of the speech. Then sometimes frequently asking other people whether what exactly they are speaking, means some asking that part. Okay, so and also asking them to tell it slowly, clearly, and more loudly. Then sometimes the need of turning off of volume of the TV and the radio. Okay, so these are the symptoms. Now, because of this, sometimes the person withdraws from conversation, then avoidance of social occasions. So these are the symptoms that we find in a person having hearing loss. Then, what are the causes? The causes depend upon the parts of the ear and any damage to these parts. First of all, damage to the inner ear. Let us first talk about the damage to the inner ear. The most important damage is because of aging. In old age, we have damage of the inner ear. That is, we call it as presbyacusis. Then another one is the loud noise. Any loud noise produce problem in the ear, hearing. Okay. Then if there is any meningitis or any other drugs, infections like meningitis, then some drugs, they cause the hearing loss. Okay. So this is in the inner ear. Next, the external ear. If there is any blockage in the external ear, say most common is wax. Wax in the external ear. If wax are collected, after long duration it becomes completely blocked, and sometimes very hard wax blocking of the ear, it becomes a problem. And sometimes it can be foreign body, some infections in the external ear causing swelling, sometimes discharge, and fungal infections, then sometimes growths. So all these are the problems which can lead to problem in the external ear. And in the middle ear, most important is infection inside the middle ear, causing rupture of the tympanic membrane or the eardrum and the discharges. So any disease inside the middle ear, which can be tumor, which can be infection, can cause hearing loss. Now another one common cause is if a slap on the head or on the ear, or sometimes a traffic accident can also cause certain injury, or sometimes blood collecting inside the middle ear, and it can also cause hearing loss. Okay, so these are the causes of hearing loss. Now let us come to the complications of hearing loss. What exactly are the complications of hearing loss? Suppose someone is having hearing loss and we have not corrected it. What will happen? The person will be isolated and will have cognitive impairment. Means some skill of the brain and the sharpness will be somehow lost in such a person. Then the person may go into depression. And especially in the children, if the child is born deaf, congenitally, that is from birth, the child will not develop speech. Most of the time I find parents coming to me and asking for cutting the tongue, having a short connection, with the floor of the tongue. So just to clear it from the floor of the mouth. But most of the time I used to say that tongue is needed for, some modulation of the speech, but it is not exactly necessary for the speech. For clarity of the speech, yes, but development of speech, no. Because development of speech, you need to hear the sound, then process in the brain, then again reply, talk. Okay, so these are the parts of the speech development. So in children, if there is hearing loss from childhood, if it is not corrected before 3 to 5 years of age, the child will not develop any speech. Or even when there is some impairment of the hearing, not completely lost, but some hearing loss in the child, to some degree, the child will have improper speech. Speech will not be developed properly. So these are the complications of hearing loss. Now, how to prevent? The most important prevention for hearing loss is to avoid loud noises. Noise can be two. One is in the workplace. Say, for example, you are exposed to, say, gunfires. If you are in the army personnel or armed personnel, gunfires, blasts and all these things, it can lead to problem in the ear, hearing. Another one is, say, in the recreation. Suppose you are hearing loud music, maybe in the concert. So these lead to problem. Even when you are using earphone with your mobile, hearing songs, then if you increase the sound, it will lead to ear damage, hearing damage, nerve damage, which is permanent. It will not come back. So all these things are to be prevented. Okay, first of all, when you hear a sound by ear plug inside your ear, and if someone standing by the side can hear some sound, then what you are hearing is too loud. Okay. Next, we need to test hearing from time to time. Testing of hearing. Then another thing which I forgot to tell you was that in the noisy surroundings, in the work environment, you have to see the level of the sound, and there should be modalities to reduce the sound and the noise in the work environment. Because if a loud noise is being exposed for many hours, then it will lead to permanent damage of the ear. Okay. Then avoid all these recreation loud noises. Then avoid drugs. Or when these drugs are to be given, then it should be monitored properly. For example, like drugs like gentamicin and its group of drugs. Okay. Then the anti-tuberculosis drugs, anti-malarial drugs, they will cause sometimes permanent damage of the ear. But like analgesics like aspirins can also cause hearing loss for some time, but sometimes tinnitus also it can cause, but it may be recovered after some time. So these are the preventive steps that we need to take. Then how to diagnosis. How to diagnose a patient is having hearing loss. First of all, by physical examination. If there is any, say for example, a child born with a atresia of the external canal, means external canal is blocked from birth, then child will definitely have hearing loss. Then we have to see any other discharge, tumors and all those things. These are all by physical examination. Sometimes we need to do MRI, okay, for any defects. Then screening of hearing we can do by whisper, talking to the person. Then ultimately some tuning fork test by doctor. Then audiometry. Okay. Then regarding treatment, if there is any problem in the external ear which can be corrected, and in the middle ear which can be corrected by surgery or by removal of wax and all, it has to be done. And last of all, if there is any hearing loss, we have to do hearing aids. Hearing aids to be given. Okay, hearing aids have got different types. I am showing here also, and different types. Small ones inside the ear given completely in the canal, and we cannot see from outside. Others are behind the ear. So these are the main hearing aids which are used nowadays. They are very effective. Okay. Next, if this person is born completely deaf from birth, then we may have to use cochlear implantation. So first of all, what we need to know here is that when to approach the doctor. If you are having sudden hearing loss, especially on one ear, then you have to approach a doctor immediately. Then another one is, say, before going to the doctor, what you are supposed to do. You have to write down all complaints, all history very nicely, and your medical problems, any kidney problems, lung problems, heart problems, everything you have to write down. Then your summary of your work history. In work, what you are exposed to, you need to write. Then take a family member along with you and write down the questions that you want to ask to the doctor, and everything you have to present to the doctor. That is how you can approach the doctor. Okay, this much for today. Thank you very much for listening patiently and supporting my YouTube channel. Thank you very much.